In this section, we are going to discuss about internet and screen addiction and children with academic difficulties. First, we will discuss about internet and screen addiction. In this section, you will learn the features of internet addiction, associated problems, and management. Screen addiction has become increasingly common in the world, especially during the pandemic. Studies done in Sri Lanka have shown that the mean duration of screen time among primary school children to range between 32.5 to 41 minutes per day on weekdays and 50.5 to 63 minutes per day on weekends. A study on screen addiction done among obese and overweight children attending the nutritional clinic in a teaching hospital in Sri Lanka showed that 41.4% of the participants were addicted to technological devices. Internet addiction has similar presentation to other addictions such as substance addiction. Typically, the time spent on internet or screens increases gradually. The adolescent has difficulty in controlling the amount of time spent on screens and often ends up being online for more than they intended. They lie to their family members about the duration of their screen use and often get angry or aggressive when parents try to limit their screen time. They may try to limit their screen time but often do not succeed. Due to the increased time they spend on screens, they give up other activities they used to enjoy and reduce the time they spend on face to face interactions. Some may use screens to distract themselves from real life problems or negative emotions. At times that they are not using the internet, they are likely to be preoccupied with thoughts related to screen use. They often have sleep problems and neglect their meals and self care. Screen addiction is associated with a range of physical and psychological problems. Physical problems include dry eyes, backache, headache, visual disturbances, sleep problems, carpal tunnel syndrome, musculoskeletal problems, and disordered eating. Psychological problems include depression, self harm, and social isolation. Internet addiction is difficult to treat and needs specialized assessment and interventions. Therefore, any child or adolescent suspected to have internet addiction should be referred to mental health services. Next, we move on to poor academic performance in children and adolescents. In this section, we will discuss the causes, assessment, and management of a child presenting with poor school performance. Poor school performance can be defined as academic performance below the expected for a given age, cognitive skills, and schooling. Research has shown that around 15 to 20% of children in their early school years have poor school performances. Poor school performance is a symptom rather than a diagnosis. It can be due to many causes. Whatever the cause, poor academic performance is associated with low self esteem in the child and significant stress in the parents. There are several causes for academic difficulties. It may be due to factors intrinsic to the child, such as low intelligence, specific learning disorders, or attention deficit hyperactivity disorder. However, environmental factors also play a role. Children who live in environments with poor stimulation may have academic difficulties. Academic difficulties may also be due to emotional problems such as depression or anxiety. This should be suspected, especially if a child who previously had good school performances presents with deterioration of school performance or recent onset academic difficulties. Environmental stresses such as parental conflicts, parental separation, and bullying may also contribute to poor school performance. Academic difficulties may also be due to a combination of a number of factors. For example, poor intelligence, parental conflicts, and bullying may all contribute to poor school performance in one child. The assessment of a child presenting with poor school performance requires taking history from many sources, including the child, parents, and importantly, the child's teacher. A detailed history, including a detailed birth and developmental history, level of independence in activities of daily living, such as the ability to maintain self care and self help skills, and features suggestive of underlying neurodevelopmental or emotional problems, should be inquired. Any environmental stresses, Family attitude towards education and parents' level of education should also be noted. Screening tools such as SNAP IV may be used to detect disorders such as attention deficit hyperactivity disorder. Intellectual disability occurs due to arrested or incomplete development of the brain, leading to lower intelligence and cognitive functions. Presence of intellectual disability is suggested by a history of global developmental delay and inability to do age appropriate activities of daily living, such as washing face, getting dressed, putting on shoes. They also have difficulty in forming age appropriate friendships. These children often prefer to be friends with younger children. Children with intellectual disability also have poor understanding of danger compared to same aged peers. A child with intellectual disability needs multidisciplinary management with the involvement of the pediatrician, psychiatrist, speech therapist, occupational therapist, and special educators where appropriate. If intellectual disability is suspected, the child should be referred to the mental health services for assessment and management by a psychiatrist. Specific learning disorders are another common cause of poor academic performance. These disorders are not due to poor intelligence. Therefore, there is usually no history of developmental delay. The reason for specific learning disorders is poor function of the left brain skills such as reading, writing, and mathematics. These children may be talented in music, art, and other creative skills which are functions of the right brain. They have equal skills in activities of daily living, such as self care and self help skills, as their same aged peers and have normal social interaction with same aged peers. Children with specific reading disorders often read slowly and monotonously. They ignore punctuation marks when reading. They often lose track of where they are reading and have poor understanding of what they read. Children with specific learning disorders often mix up similar letters and numbers such as B and D, P and Q, N and U, and make frequent spelling mistakes. They often have poor handwriting and usually do not separate words when they write. They fail to put punctuation marks when writing. Children with specific disorders of mathematics may find it difficult to learn numbers and to comprehend the meaning of mathematical symbols. They tend to continue to use their fingers for counting long after their same aged peers. They mix up similar numbers and have difficulty in learning multiplication tables. This slide shows samples of writing and mathematics of children with specific learning disorders. Children suspected to have specific learning disorders need to be assessed by a psychiatrist and needs remedial teaching. Therefore, if a child is suspected to have specific learning disorders, the child should be referred to the mental health services for assessment and management by a psychiatrist. Poor academic performance can sometimes be due to an underlying emotional disorder. An emotional disorder should be suspected if the child previously had good or average school performance and the school performance has deteriorated recently. If there are other symptoms suggestive of emotional problems, such as low mood, lack of motivation, changes in sleep pattern, changes in appetite, social withdrawal, excessive fear, or expression of thoughts of self harm. If a child is suspected to have an emotional disorder, they should be referred to the mental health team for assessment and management. Whatever the reason for poor school performance may be, parents should be advised that the child should not be punished for academic difficulties. They should not be compared with their siblings or peers. Parents should be educated that punishment and comparing will only make the child dislike the schoolwork and may lead to emotional problems or worsening of school performance.